4 everyday fruits you should never eat, and 4 you must eat. Grapefruit. Grapefruit is one of the most surprising fruits that seniors over 65 are often advised to avoid, especially if they take certain medications. While it may seem like a healthy choice, loaded with vitamin C and refreshing flavor, grapefruit interacts with a wide range of common prescriptions in ways that can be dangerous. Some doctors refer to it as the silent disruptor because its effects aren't felt immediately but can build up over time, often unnoticed until a complication arises. The issue lies in how grapefruit affects enzymes in the small intestine, specifically an enzyme called CYP3A4, which plays a major role in breaking down many drugs in the body. When this enzyme is blocked, as it is by compounds in grapefruit, the medication isn't broken down properly and ends up in the bloodstream at much higher levels than intended. This reaction can be particularly dangerous for seniors because the medications involved are often those prescribed for chronic, life-threatening conditions like high blood pressure, high cholesterol, anxiety, depression, or heart rhythm problems. One of the most well-known examples is the interaction between grapefruit and statins, a class of drugs used to lower cholesterol. When taken with grapefruit, certain statins, such as simvastatin and atorvastatin, can accumulate to toxic levels in the body, raising the risk of severe side effects like muscle breakdown, liver damage, or kidney failure. For those on calcium, channel blockers for high blood pressure, grapefruit can cause excessive lowering of blood pressure, leading to dizziness, weakness, or even fainting. Some antidepressants and anti-anxiety medications can also be affected, leading to higher levels of sedation or confusion. The problem isn't limited to fresh grapefruit. Grapefruit juice, even in small quantities, has the same effect. Some studies have shown that just 1 glass of grapefruit juice can significantly increase the concentration of certain drugs in the blood, and the effects can last for up to 72 hours. This means that even occasional consumption can have lasting consequences. What makes this especially concerning is that many seniors may not be aware of the risks. Grapefruit is still promoted in many wellness circles and often included in diets aimed at heart health, making it easy to assume it's always safe. Pharmacists usually place warning labels on medications that shouldn't be taken with grapefruit, but these labels can go unnoticed or be misunderstood. Not all doctors mention the grapefruit warning during appointments, especially when a patient is taking several prescriptions and trying to manage multiple conditions at once. This makes it even more important to double-check medication instructions and ask a healthcare provider directly whether grapefruit is safe. When managing health after 65, even small food choices like fruit can have big consequences. Avoiding grapefruit is a simple but powerful step in making sure that medication does its job without dangerous interference. Watermelon. Watermelon, though often seen as a light and refreshing treat, can be a problematic choice for many people over the age of 65, especially those dealing with blood sugar issues. Its sweetness may seem natural and harmless, but watermelon has a high glycemic index, meaning it raises blood sugar levels more quickly than many other fruits. For seniors, whose bodies often process sugars more slowly and less efficiently, this rapid spike can create unnecessary stress on the system. Some doctors caution that frequent blood sugar spikes followed by sudden drops can lead to feelings of fatigue, dizziness, shakiness, or even confusion, especially in older adults who may already struggle with energy or balance. Even though watermelon contains water and small amounts of fiber, it's also packed with natural sugars. A single cup of diced watermelon contains about 9 to 10 grams of sugar, and it digests very quickly. This quick digestion doesn't give the body enough time to gradually process the sugar, leading to a fast rise in blood glucose. In younger people with healthy insulin function, this might not be a concern. But in seniors with insulin resistance, borderline prediabetes, or diagnosed type 2 diabetes, that fast rise can cause a blood sugar roller coaster that impacts mood, cognition, and long-term health. What makes watermelon especially risky is that it doesn't always feel like a sugary food. Because it's light and hydrating, people tend to eat it in large portions, often unaware of how much sugar they're consuming. During warmer months, it's common for seniors to eat multiple slices in one sitting, sometimes equal to 3 or 4 cups. That means consuming 30 to 40 grams of sugar in a matter of minutes, which can be a serious concern for anyone managing blood glucose levels or trying to avoid complications related to insulin spikes. Studies on older adults with prediabetes have shown that high glycemic foods like watermelon contribute to poor glycemic control over time. This means more fluctuations in energy levels, higher risk for insulin resistance, and greater chances of developing complications such as neuropathy, vision problems, or kidney strain. Some nutritionists working with older patients suggest choosing fruits with a lower glycemic index to avoid these issues. They also emphasize that seniors often have slower digestion and altered metabolism, making it harder for their bodies to bounce back from sugar crashes the way they could in younger years. Watermelon may still be fine for some people in moderation, but for those already dealing with blood sugar concerns or trying to prevent them, it's a fruit that's better avoided, or at least carefully limited. Choosing fruits that release sugar more slowly and offer more fiber or healthy fats can make a significant difference in how steady and energized a senior feels throughout the day. Dried fruits like raisins, dates, apricots, and figs may seem like wholesome snacks, but for seniors over 65, they often deliver more harm than good when eaten regularly or in large amounts. The drying process removes water and significantly concentrates the fruit's natural sugars, especially fructose. What's left is a small, chewy portion packed with calories and sugar, essentially a dense source of quick energy, with very little bulk. While they still contain some vitamins and fiber, the sugar load can be overwhelming for older adults, especially those managing inflammation, joint problems, or weight-related issues. Some nutrition experts even refer to dried fruits as sugar bombs in disguise, because they look innocent but hit the body hard. One of the main concerns with dried fruits in seniors is the way fructose affects inflammation. Research has linked high fructose intake to increased levels of inflammatory markers in the body, which can worsen existing joint pain or contribute to chronic conditions like arthritis. For someone already living with sore knees or stiff hands, adding more dried fruit to the diet can quietly fuel that inflammation, making everyday movement more uncomfortable over time. Inflammatory flare-ups aren't always immediate, which makes the connection harder to notice, but over weeks and months, regular intake of dried fruit can silently chip away at physical comfort and mobility. Another issue is how easy it is to overeat dried fruits without realizing it. Because they're small and concentrated, a handful of raisins or a few dates might not feel like much, but they can contain as much sugar as a candy bar. Seniors who are trying to maintain a healthy weight or control their blood sugar may unknowingly sabotage their efforts by snacking on dried fruits throughout the day. Some packages even include added sugars or syrups, especially in products like dried cranberries or mango slices, which further increase the calorie and sugar content. Without clear labeling, many people assume they're making a healthy choice when, in reality, they're consuming far more sugar than intended. For those dealing with metabolic issues like prediabetes or insulin resistance, dried fruits can trigger quick blood sugar spikes, followed by crashes that lead to fatigue, irritability, or cravings. And for seniors with slower metabolisms or limited physical activity, the excess calories can gradually contribute to weight gain, putting more pressure on the joints and increasing the risk of other complications. Some dietitians working with older adults recommend limiting dried fruits or replacing them with fresh, whole options that offer more volume, hydration, and fiber for fewer calories. While dried fruits might seem like a smart snack, their hidden sugar and inflammatory effects make them a food that many seniors are better off avoiding. Fruit juice. Fruit juice may seem like a healthy choice. After all, it's made from fruit, right? But for seniors over 65, this everyday beverage can quietly sabotage health in ways many people don't realize. Whether it's orange juice, apple juice, grape juice, or even a 100% natural blend, the truth is that fruit juice is often just liquid sugar, stripped of the fiber and nutrients that make whole fruit beneficial. The main issue is how fruit juice affects blood sugar. Unlike whole fruits, which contain fiber that slows the absorption of sugar, juice delivers a fast dose of fructose straight into the bloodstream. One glass of orange juice can contain as much sugar as a can of soda, and since it's liquid, it's absorbed even faster. For older adults, especially those managing type 2 diabetes, prediabetes, or insulin resistance, this spike in blood sugar can be dangerous. It puts pressure on the pancreas to produce more insulin and can lead to energy crashes, inflammation, and long-term damage to blood vessels. Many seniors drink juice as part of their breakfast, believing it's a healthy way to start the day. But this habit can lead to an early blood sugar surge, followed by a mid-morning crash, bringing fatigue, irritability, and increased hunger. Over time, these cycles can contribute to weight gain, difficulty managing appetite, and even cognitive fog. Some studies link high fruit juice consumption to increased risk of metabolic syndrome, heart disease, and fatty liver, all conditions that become more common with age. Even more concerning is that many commercial juices, even the ones labeled no sugar added, are made from juice concentrate or have been heavily processed, removing key nutrients while concentrating sugars. These juices lack the protective benefits of chewing, slow digestion, and fiber, making them a poor substitute for whole fruits. And because juice is liquid and easy to drink quickly, portion control becomes a serious problem. It's easy to down 8 or 12 ounces in seconds, much harder to do with, say, 3 whole apples. Some juices also contain preservatives like potassium sorbate or additives like natural flavors and citric acid, which can irritate sensitive digestive systems or trigger acid reflux, a common issue in older adults. Blueberries. Blueberries are among the most powerful fruits seniors over 65 can include in their diet, especially when it comes to protecting the brain and supporting overall aging. These small, dark berries are rich in antioxidants, particularly a group called anthocyanins, which are known for their ability to fight oxidative stress. Oxidative stress is one of the key contributors to age-related cognitive decline, and it occurs when unstable molecules, called free radicals, damage cells over time. Some research has shown that the antioxidants in blueberries can help slow this process, keeping brain cells healthier and potentially improving memory in older adults. Several studies have examined the effects of blueberries on the aging brain. In one clinical trial, seniors who consumed blueberry juice daily for 12 weeks experienced measurable improvements in memory tests compared to those who did not. Researchers believe that the compounds in blueberries may improve communication between brain cells and even support the growth of new connections. This kind of support is especially important as people age and begin to notice occasional forgetfulness or slower recall. Some doctors refer to blueberries as brain berries because of how consistently they appear in research related to cognitive support. In addition to their brain benefits, blueberries also support heart health. Their anti-inflammatory and blood pressure lowering properties are particularly helpful for seniors managing cardiovascular risk. Inflammation plays a major role in heart disease, and chronic low-grade inflammation becomes more common with age. Blueberries help counter that through their natural compounds, which can reduce the stiffness of blood vessels and promote better circulation. For seniors, improved circulation supports not only the heart but also muscles and joints, helping with everyday mobility and energy. Blueberries are also naturally low in sugar and high in fiber, which makes them a smart choice for older adults concerned about blood sugar levels. Unlike high glycemic fruits that can spike blood glucose, blueberries release their sugars more slowly, helping to maintain stable energy without crashes. This makes them a good option for people with insulin resistance, prediabetes, or type 2 diabetes. Nutritionists often recommend them as a sweet treat that doesn't disrupt blood sugar control. Some mobility researchers have noted that diets high in antioxidant-rich foods like blueberries are associated with slower physical decline. While blueberries alone won't prevent mobility loss, their support for blood flow, reduced inflammation, and cell protection can make a meaningful difference over time. Seniors who include blueberries regularly may feel steadier, more energetic, and mentally sharper. Whether eaten fresh, frozen, or blended into smoothies, blueberries offer real benefits that go beyond taste. Their unique combination of brain, heart, and metabolic support makes them one of the best fruits for anyone looking to age with strength, clarity, and resilience. Avocado. Avocados, often mistaken for a vegetable, are actually a fruit packed with nutrients that are especially valuable for seniors over 65. What makes avocados stand out is their rich content of heart-healthy monounsaturated fats, particularly oleic acid. These fats have been shown to help lower levels of LDL cholesterol, the type associated with arterial plaque buildup, while supporting the rise of HDL, the good cholesterol that helps clear the bloodstream. For older adults concerned about heart health, which becomes a higher priority with age, this makes avocados an important ally. In addition to healthy fats, avocados are a great source of potassium, even more so than bananas. Potassium plays a key role in controlling blood pressure by balancing out the effects of sodium. Many seniors are advised to monitor their sodium intake, especially those with hypertension or heart disease. Including more potassium-rich foods, like avocado, helps maintain proper fluid balance, ease pressure on the arteries, and reduce the risk of stroke. Some cardiologists recommend potassium-dense foods as a natural complement to blood pressure medications, provided there are no kidney concerns. Avocados are also rich in dietary fiber, both soluble and insoluble. This fiber combination helps regulate blood sugar by slowing the digestion of carbohydrates, resulting in a gentler rise in glucose levels after meals. This is particularly helpful for seniors managing insulin resistance or type 2 diabetes. Unlike sugary fruits that can cause sharp spikes in blood sugar, avocado has minimal natural sugar and helps stabilize energy throughout the day. Its creamy texture also makes it easy to digest for those with slower digestive systems, while the fiber supports regular bowel movements and gut health. Another benefit of avocados is their potential role in supporting joint health. Their natural fats, along with certain plant-based compounds like phytosterols, have anti-inflammatory effects that may ease joint stiffness and discomfort associated with aging or conditions like osteoarthritis. While not a cure, regular intake of anti-inflammatory foods can contribute to greater comfort and mobility over time. Some studies have shown that seniors who consume monounsaturated fats regularly report fewer issues with joint pain and stiffness during daily activities. Lastly, avocados are a highly nutrient-dense food containing folate, vitamin K, vitamin E, and small amounts of magnesium and lutein, nutrients that support everything from bone strength to eye health. Because they are so versatile, avocados can be easily included in a senior's diet, whether mashed, sliced, or blended. Their gentle effect on blood sugar, support for cardiovascular function, and ability to nourish joints and muscles make them one of the most well-rounded fruits for healthy aging. For seniors looking to maintain vitality, adding avocado to meals can be a small but meaningful step. Apples. Apples with the skin are one of the most beneficial fruits for seniors over 65, especially when it comes to digestive comfort, immunity, and blood pressure regulation. The skin of the apple contains the majority of its dietary fiber, including both soluble and insoluble types. Soluble fiber helps to slow digestion and regulate blood sugar levels, while insoluble fiber adds bulk to the stool and supports regular bowel movements. Constipation is a common concern as people age due to slower digestion, reduced physical activity, or side effects from medications. Including apples with the skin in a daily diet can offer gentle, natural relief without the harsh effects of over-the-counter laxatives. Beyond digestion, the fiber in apples plays a larger role in maintaining overall gut health. A healthy gut supports better nutrient absorption, stronger immune defenses, and even emotional balance. Pectin, a type of soluble fiber found in apples, acts as a prebiotic, feeding the beneficial bacteria in the colon that are essential for a resilient digestive system. Some studies have shown that diets rich in prebiotic fibers can enhance immune responses and reduce the frequency of certain infections, which becomes particularly important for seniors with weakened immunity. Flavonoids. In apple skin, especially quercetin, are another reason this fruit is valuable for aging adults. These naturally occurring plant compounds have been studied for their anti-inflammatory and antioxidant effects. They help neutralize oxidative stress in the body, which is one of the underlying contributors to many chronic age-related conditions. Quercetin in particular has been associated with better lung function, lower blood pressure, and enhanced immune performance. These effects are not dramatic overnight, but over time, they can support long-term health and resilience. Apples also contain vitamin C, which plays a well-established role in immune defense by helping white blood cells function more effectively. For seniors prone to colds or respiratory infections, this added support is especially helpful. When consumed regularly, apples can contribute to an immune system that responds faster and more efficiently. This becomes even more important in the colder months when immune responses may be slower or less robust in older adults. Blood pressure regulation is another benefit linked to apple consumption. The potassium content in apples helps balance the effects of sodium, which many seniors are advised to reduce. This mineral assists in relaxing blood vessel walls, supporting smoother blood flow, and decreasing strain on the heart. While apples are not as high in potassium as fruits like bananas or avocados, they still provide a helpful contribution to a heart-healthy diet. Apples are easy to chew for most seniors, especially when sliced thin, and they're portable, affordable, and available year-round. Eating them with the skin ensures maximum nutritional benefit, as peeling them strips away much of the fiber and flavonoids. For older adults focusing on digestion, immunity, and heart health, a daily apple with the skin is a simple but powerful choice. Papaya. Papaya is a fruit highly regarded for its unique digestive benefits, making it especially suitable for seniors over 65. One of the most important components of papaya is an enzyme called papain, which assists in breaking down proteins in the digestive system. As digestion naturally slows with age, many older adults experience discomfort such as bloating or indigestion after meals. Papain helps ease these symptoms by aiding the body's ability to process protein-rich foods more efficiently. This enzymatic support can reduce the strain on the stomach and intestines, promoting more comfortable digestion and helping prevent the common digestive troubles that come with aging. Beyond its digestive enzymes, papaya is an excellent source of vitamin C, a powerful antioxidant essential for immune health and tissue repair. Vitamin C plays a crucial role in maintaining healthy skin, which often becomes thinner and more fragile in seniors. Its antioxidant properties help protect the skin from damage caused by free radicals, which can accelerate aging and reduce skin elasticity. Maintaining adequate vitamin C intake through fruits like papaya supports skin resilience, wound healing, and overall appearance, allowing older adults to retain healthier, more youthful skin longer. Papaya is also rich in beta-carotene, a precursor to vitamin A that supports eye health. As vision issues like macular degeneration and cataracts become more common with age, incorporating beta-carotene-rich foods can offer some protective effects. Beta-carotene helps maintain the health of the retina and other eye tissues, contributing to better visual function. Some studies suggest that diets high in beta-carotene are associated with slower progression of age-related eye diseases, making papaya a valuable addition for seniors wanting to safeguard their eyesight. In addition to these benefits, papaya contains a variety of other nutrients such as folate, potassium, and fiber. Fiber in papaya promotes regular bowel movements and supports overall gut health, which is vital as constipation tends to increase with age. Potassium aids in blood pressure regulation, another critical concern for older adults. Together, these nutrients contribute to papaya's reputation as a nutrient-dense fruit ideal for seniors aiming to maintain overall health. Moreover, papaya's soft texture and natural sweetness make it easy to consume and digest, especially for those who may have dental issues or difficulty chewing. It can be enjoyed fresh, blended into smoothies, or added to salads and desserts. Some doctors highlight papaya as a gentle yet effective fruit for seniors due to its combination of digestive enzymes and antioxidant nutrients. This dual action of aiding digestion while protecting the skin and eyes makes papaya a well-rounded choice for healthy aging. Regularly including papaya in the diet can support comfort, vitality, and wellness in later years. As we've seen, choosing the right fruits can make a real difference in how seniors feel every day, supporting digestion, heart health, blood sugar balance, and even brain power. Avoiding certain fruits that may interfere with medications or cause unwanted spikes is just as important as embracing those that nourish and protect the body. Remember, it's never too late to make small changes that add up to a stronger, healthier, and happier life. If this video helped you understand which fruits to welcome or avoid after 65, please like, share, and subscribe. Your health journey matters, and here's to thriving with every bite.